Hey guys, welcome back to my YouTube channel. Hope you guys are having a nice day. So this is Boris the midwife, and in today's video I'll be talking to you all how to diagnose cord round neck during labor without the use of an ultrasound. Yeah, this is something that I've had the opportunity to pick up from my years of experience as a nurse midwife. So it's not something you're going to find on the internet or in any textbook. You're not going to find on the internet how to diagnose cord round neck without an ultrasound. Yeah, I've even gone through a lot of obstetrics books where I haven't found anything on that, on how to diagnose cord round neck without an ultrasound. I have the first aid obstetrics. I have case files. That's where there are a lot of cases and how to tackle them. That's cases on obstetrics and how to tackle them. So I've gone through a lot of books, but I haven't seen anything concerning how to diagnose cord round neck without the use of an ultrasound. So these indications or signs that I'll be sharing with you all today is something that I have had to pick up from experience. I've had about 10 cases or more, and they all prove the same. These babies all came out with cord round neck. The signs were the same, and the babies all came out with cord round neck, either a loose cord round neck or a very tight cord round neck. So what I'm about to share to you today is practice based. Yeah, so just stick to the video and learn what you can. Trust me, it's going to help you or somebody someday. So during the active phase of labor, that's when the woman is about 5 centimeters, 6 or more dilated, the pathogram will tell you that you need to monitor the fetal heartbeat every 30 minutes. Yeah, but that doesn't mean you should just go and monitor the fetal heartbeat without contractions for a period of about 5 or 10 seconds and you go away. Some hospitals are fortunate to have sophisticated equipment like the cardiotocograph or the CTG. Cardiotocograph helps monitor the fetal heartbeat throughout the labor process. That's cool, right? It monitors with and without contractions. So it tells you how the baby is doing with contractions and how the baby is doing without contractions. And it also records the vital signs of the woman. So it's a very cool machine. But for institutions who don't have the CTG, as they have just a penile stethoscope or the electronic fetal Doppler, they can as well use this to monitor the heartbeat of the baby. They can as well perform a non-stress test. A non-stress test is monitoring the baby's heartbeat without contractions and with contractions. So that's what I've been doing at work because our CTG had an issue. So I've been using more of the electronic fetal Doppler, and I diagnosed these cord round neck cases with that electronic fetal Doppler. With the use of it, it helped, not just it, but it helped me to diagnose, because the fetal heartbeat is a sign. It's one of the signs that can tell you that the baby has a cord round neck. So the first sign you want to notice is that during contractions, you need to monitor the baby's heartbeat without contractions for about a period of 1 minute, and you need to monitor with contractions for a period of about 1 minute. What you will notice is, what if you notice that the baby's heartbeat during contractions is decreasing or increasing? That's not something you should ignore. Never ignore any tiny detail in obstetrics, because this might cost life. So never ignore it. In health in general, never ignore any tiny detail. So if with contractions you notice that the baby is having a decrease in heartbeat or an increase in heartbeat, then this is a call for concern. The lady is in the active phase of labor. What you want to do is, or what you should have in mind is, how is the nature of the amniotic fluid? If the membranes are intact, how is the nature? If they have rupture, how is the nature of the amniotic fluid? Is it clear or is there meconium stain? If there's meconium stain, what type of meconium stain is it? Because there are two types of meconium stain. You have the thick meconium stain liquor, which is a significant meconium stain liquor, or we have the greenish or yellowish meconium stain liquor. And this type is called a non-significant meconium stain liquor. So it's very important for you to know about this type of meconium stain liquors. And both of them, they are very important. They all will indicate that there is fetal distress, of course, but not all may indicate that the baby has a cord round neck. So the third point is, now you want to do a vaginal exam. When you do a vaginal exam after rupturing the membranes of the woman, or if the membranes had ruptured before, if you know during vaginal exam, is there caput formation? Is the baby's head swollen? Or is there malposition? Is the baby not at the position of the baby? Maybe the baby is not well, the head of the baby is not well applied on the cervix. Then this is a call for concern. But if the baby's head is well applied on the cervix, there is no caput formation, and there is significant or non-significant meconium stain liquor, and there is fetal distress, then this is a good conclusion that there is cord round neck. Understand? Yeah, it's a good conclusion. So I'm going to go through these signs again. There are about 4 of them. The first sign is with contractions, there is a decrease in heartbeat or an increase in heartbeat. The second sign is there is either a significant or a non-significant meconium stain liquor. The third sign is the baby's head is well applied on the cervix. And the fourth sign is there is no caput formation, that's there's no swelling of that baby's head. These 4 signs in place, you can go ahead and tell anybody that that baby in the womb has cord round neck. It can either be loose or tight cord round neck, but all the same, if effective measures are not taken, the baby might come out with either severe or moderate birth asphyxia, as the baby can come out with a low APGAR score, and we don't want that in obstetrics. So guys, I hope this video was helpful. You can always leave your comments in the comment section below and tell me a video you'd like for me to create, and I'll do my best to make that happen. This has been Boris, the midwife. Your health is my priority. I'll see you all in my next video.